Hello, my name is Damian Christian. I'm with the Men's Health Network, and with me I have Dr. John Bonhomme. So, Dr. Bonhomme, could you explain why opioid addiction is a medical problem and not a moral flaw?
Because people don't realize it, but opioids actually alter the way that the brain works. People think that, oh, they can quit if they want to, or they're just doing it because they like it. First of all, a lot of the people that I've had to treat it, a surprising number of people actually, didn't get addicted because they were trying recreational drugs or partying or trying to feel a certain way. A lot of them became addicted because they got hurt. First of all, there are underlying medical problems that drive people to use opioids in the first place. And these things can be chronic pain, they can be related to injuries, they can be chronic pain related to disease, they can be psychological disorders. If a person has severe depression or anxiety or some sort of mental issue, they may be self-medicating in order to try to feel better for their mental issue. But a lot of the people that I had to treat for opioid dependence were actually people who may never have drank or even smoked a cigarette before they got hurt. So the issue is that there are medical issues that are driving people to use drugs. The second issue is that opioids actually alter the way that the brain works when a person has been on them for too long a time. The medical profession, in its prescription of opioids, sometimes has not use them properly. They need to be used for generally for short periods of time unless it's absolutely necessary. Otherwise, you risk the person becoming addicted, even if they were using it for medical purposes. Some people that I've seen, they were injured, they were put on high doses of opiates for 6 months, and then all of a sudden discontinued. And they needed to be tapered. They needed to be brought down very gradually, but this sudden abrupt cessation, they were already in a state where they would get withdrawal if they didn't continue with the drug. So in order to cope with that withdrawal, you can put a person on a high dose of opioids for a short period of time. If it's for a long period of time, you have to bring them off gradually, and a lot of the time that is not done. What actually happens in the brain is that there are certain chemicals produced in the brain that normally have certain levels, and when you give the person opiates, those levels change. When you take away the opiates suddenly, they don't resume normal. So the person may have a withdrawal syndrome, they may have vomiting, they may have sweating, they may have shakes, they may have rapid heartbeat, they may have high blood pressure, they may feel terrible. But in addition to that, they may be unable to enjoy anything, because the opioids affect the pleasure chemicals in our brain like dopamine. So the point is that when a person is on opiates and they're having trouble stopping, even if they want to, I've spoken to addicts say, I was sitting there shooting up drugs. I didn't know why. I felt like a spectator watching myself do it. I didn't want to do this. I said, why am I still doing this? But it was the arrangements of the brain chemistry that were forcing them to do that. So we need to treat opioids like a medical issue. And it's also vitally important because with the issue of medical records, if you conceal the fact that the person is on a certain drug and a doctor is trying to treat them and they don't know that they're on that drug, they may not be able to interpret their symptoms correctly. They may interpret some symptom that the person is having as being related to some disease when it's actually the drug, or they may prescribe a drug that interacts poorly with the drugs that the person is on. You may give them a drug and it may lead to an overdose because of the interaction, or it may undermine another treatment. So the point is that you need to know everything that the person is on. So I think we need to move opioid addiction out of the moral realm and into the medical realm. I think we need to treat it just like any other disease, like hypertension or diabetes. There are physical correlates to this disease, and it needs to be treated as such.
Thank you so much.